Hello,
Are we live?
everyone. Yes, we are live.
Hi.
So, how things are? I hope that you have come up with your best thoughts and a collaboration. So, this is the judging
Yes.
time. I'm going to pass it to you, this.
Yeah, so this will be the judging time. Okay, I think I'm lagging. Can you hear me, Dr. Debbie?
Yes, I can hear you loud and clear.
Okay, great. So yeah, the judges will join us here at the stage, and we will start with Group A to Group G later on. So each team will have 3 representatives invited to present. Each team is given 3 minutes to impress and 5 minutes for Q&A. A total maximum of 8 minutes of presentation within your AMI track. So within this track, you are encouraged to present what you have done. If your hack is broken or you weren't able to finish, it's okay if you don't finish your hack. That happens all the time. So top 3 winners of each track will be chosen to proceed to the final. Okay, let's just start with the first team. Group A, are you guys ready? So some of you. Okay, I'll invite Priyansh. Wait a second. Okay. Okay, Priyansh, can you accept the? Okay, next is Osh. Oh, Priyansh. Is Priyansh in the stage? Is Abdi? Okay, the team, are you guys ready? Because I'm invited you to the.
Hey, Yodesh, is my screen visible?
Yes, Samar.
Now
Yeah.
visible?
Yes, it's visible.
Okay.
Okay, so I'm just going to. Priyansh, can you accept the attendee? Sorry, I'm having a bit difficulty here. Oh, where's Priyansh? Priyansh. Okay, great. Is Priyansh on the stage? Some of you, can you see Priyansh?
Hello, am I
Oh,
audible?
okay, yeah, he's here. Okay, and then the second person is Diksha. And then the last is Ocean. Oh, I'm so sorry, Ocean. Are you on? Are you going online from your phone? Because I cannot invite you to the stage.
Can we have Miguel, if it's possible? I think
Sorry,
Oshish,
Michael.
no, Oshish not able to connect.
Okay, let me just add. What's the name again?
It's Miguel.
Sorry.
I'll just type the name down 1 second.
Okay, I'm so sorry. Let me just invite our judges first. Dr. Jordan, you can accept the invitation. Okay, thank you so much. And then Dr. Bimo. Is Dr. Bimo here?
Oh,
Okay, Dr. Bimo.
Dr. Bimo is currently unavailable. I'll be doing the judging instead.
Oh, okay. We'll wait for Dr. Bimo first to accept the invitation.
I think he is not going to be here.
Oh, also?
Yes.
Okay, so we can start. Okay, I'll invite Mijas. Mijas. Okay. Mijas, you can accept the invitation so that we can start. Okay, Mijas. Okay, great. So you guys are all in, and the judges are also in.
Next question. I have a query.
So yes, Priyansh.
So am I supposed to say next slide, or how
Yes.
is it?
Yep.
Okay.
Okay. I'm so sorry. I just want to confirm. Can you guys see me just because here I cannot see him in my list.
Um,
Okay, Samavik, can I see the list on your side? Yes, that one. The stage list, the stage one on your right. No, pre Okay, he's here. Yeah. Okay, but he's not here. Also, wait. Let me just remove. Right. Just you can accept it. The invitation. Okay, we're waiting for a response. For the other group, please be ready. After this, we have group B and can see. Oh, has accepted the invitation, but we cannot see Minjas. Okay, wait a second. Minjas, can you refresh your air meet just to make sure because we need. Can we just? I'll send you another invitation. Minjas, are you there? Oh.
Yudis, can you please invite Dr. JY?
Yes, Dr. Devi. I just received his direct message. Wait a minute. Okay, Dr. Jawa, I'm sending you the invitation. Okay. Oh, Mijosh,
Um, uh,
have the name that going to present Priyansh.
Okay, how can I help you? You this?
I'm still waiting for Mijosh to accept the invitation, Dr. Devi.
Okay, you need the Priyas, is it? Who is Priyas group member? Can you please ask him to pick to take the invitation?
he says that he has accepted the invitation. I guess there's some technical error.
Oh,
Maybe can we invite Ayushma from the team? I have mentioned the name.
okay.
No
Let,
problem.
let me try.
Yeah, I think for subsequent teams as well. While we're sorting this out, I think it will be better if you can have a discussion among your group mates and elect a
Yes,
backup presenter in the
yes,
event a similar incident happen again.
Yes,
So that will save us some considerable time. Thank
yes,
you.
and
okay.
we can raise hand those who are elected as the person who is the spokesperson for that group. Please raise your hand so that the host can quickly identify who you are and can bring you up to the stage.
Okay. Okay, Dr. Debbie and Dr. JY, Dr. Jordan, they are all here. So, Priyansh, are you guys
Okay.
ready?
Can you hear my voice, Yudis?
Yes, Dr. Jordan, we
Okay,
can
because
hear
I
you.
just changed
Yes,
my laptop, so I have difficulty to enter before. Okay,
Oh,
let's
okay.
start.
Okay, it's loud and clear. Okay, some of you can show the slide. Okay,
Okay.
Priyansh,
Yeah.
is it clear?
Yeah.
Okay, we're going to start the 3 minutes for off the presentation, eh? Okay, good luck.
Thank you. Okay. Lay new normal, a potential causative behind the uncontrolled spread of COVID-19. Next slide. These are our team members, the defibrillators. Next slide. Okay, so the problem statement over here. So whole motto behind our project is the sky is the limit. It's 3D printing technology. So what is the problem? COVID-19 spread. It spreads by contact, and the demand of critical care has been increased. So if it spreads by contact, the contact reduction is required. That is implementation of lockdown was done. Because of which industrial production was shut. At the other hand, demand of critical care has increased. That means increased production of ventilators and PPE. So if the production of ventilators and PPE have been hampered. So there's no increase in production and there's increased spread and death rate. Next slide. Okay. So now deficiency of PPE and COVID-19 spread, healthcare workers are also falling ill and insufficient sufficient treatment facilities, especially in countries LMICs, that's lower middle income countries. So next slide. Solution to all is 3D printing. Why? Why is this a solution? Next slide. Basically what to print ventilator splitters so that one ventilator system can support multiple patients at one time, reusable masks and shields because we are falling in short of these, especially in LMICs, and plexiglass boxes. Next slide please. Okay, why to print? Okay, so one ventilator is equal to 9 ventilators with the help of splitters, and the production cost of one splitter is way less than cost of 8 more ventilators. No shipment delay, production cost can be controlled. And plexiglass boxes, no contact with patient's breath during sample collection, clear physical visibility of patient because it's transparent, no shipment delay again, and production cost can be controlled due to supply and demand. Next slide. So, reusable masks again, no contact with patient's breath, bridging the gap, bridging the supply demand, less visual resources. Next slide. Implementation strategy. Next slide. The cost. This is a basic cost, and it's pretty much cheap compared to normal production of commercial ventilators and etc. Next slide, please. Okay, so who will print it? These are some of our potential sponsors, which we would like to share. Next slide. Okay. So before we come into the references, there are some points like the financial liabilities. The initial cost of setting up the printers is something
Hello, Priyansh.
I think he lost his connection.
Okay, the other team can back him up.
You distracted him
Yes.
and an additional 10 seconds. He disconnected roughly around the 17 seconds time mark.
Okay, Dr. JY.
Thank you so much for noticing that.
Thank you, Dr. JY.
Welcome.
Okay, other members that want to help him, probably Abik, you may unmute yourself and continue.
Yeah, so am I audible?
Yes, great.
Yes. So, so our idea is to build 3D printers to implement those things in creating more equipment for medical system, including masks and ventilator splitters. Since one ventilator would help only one patient, but ventilator splitters, one ventilator can help about 10 patients. So the production cost would be more less than developing individual ventilators. So I think that is a great prospect.
Okay, thank you so much, Abik. Your time is up. Okay, now we're going to proceed for Q&A session. Please, judges or any attendees who wants to ask questions about this, you may use the raise hand or even the question tab on your right.
Okay, I have one comment and one question for this regard. Question is, did you manage to find any articles comparing the ability of 3D printing a ventilator parts, or specifically what ventilator parts are they printing?
Yes, we did find it.
Okay, so what kind of ventilator parts are they printing most of the time?
Okay, the splitters and then tube, and these are the major parts which are being produced.
Any comparison on the cost feasibility? Because I believe that 3D printing is actually time consuming, and they actually cost more compared to conventional factory production.
Okay, so basically, I would really request the host to like go through the cost slide, because we had been doing the cost analysis of the same. So if we can go to the slide which shows the cost analysis.
Okay.
Yes. Yes. So as we can see, it's not only about the cost of it and also the employment of it. So the Indonesian statistics shows that the monthly income ranges from $101 to $676. So yes, employment is something which is happening for sure. And it's basically the initial cost of establishing such printers is something high, but the cost is approximately $0.5 per gram, which is pretty much cheaper. And if we talk about best cheap model printer in Nepal, is as of now it's $900, which is pretty much high in the beginning, but post which the cost is pretty much low, because cost per kg is $35 to $75 depending upon the materials. And one more thing is the 3D model is pretty much lighter in weight, so the cost per kg is really economical.
Okay. More questions from the floor?
Yes, any more further questions from the floor you may ask? Or judges, if you want to ask anything else, Dr. Debbie, Dr. Jordan.
I'm happy.
Okay, Dr. Debbie is happy.
Right. I have two comments regarding this. Number one,
Okay.
plexiglass. Yes. I like your idea of using a 3D printing technology to solve the problem of item shortage. However, you need to understand that 3D printing, they cannot come out with a very flat surface and completely transparent item. So 3D printing a plexiglass might pose some problems. And number two, you need to realize that this is like, but I do agree with your idea, but in real life you need to understand that this is a desperate solution to a desperate scenario. In normal circumstances, we will try to avoid splitter, because when you use a splitter, you cannot individualize the setting of ventilator single patient, right? So that's my comment. You
Okay.
have a
Oh,
questions there. Sorry, you have a question there.
yeah. Uh, wait. Okay, question from Ayush. How are the use of 3D printed ventilators approved and regulated in critical care?
Sorry.
How are the use of 3D printed ventilators approved and regulated in critical care?
So basically, as mentioned, that it's basically about the desperate measures where we are supposed to have such 3D printing methods being used. But if we see the scenario right now as well, post COVID, we were not able to like provide the adequate facilities to the people at large. So basically, it's fine that the industrial production is happening, good, but at the same moment, this 3D printing technology being approved in such critical care is something which is happening because of the lack of infrastructure which we do have. So yes, it's gonna help out increase the demand as soon as possible and to get back to normal, because the key performing indicator again is the number of lives saved.
Okay, thank you so much, Priyansh. So I think we're short of time. Thank you so much for Group 2A for your time and good
And
luck.
I want to remind the other judges, Dr. Jewa and Dr. Jordan, to use the judge sheet and type it in to the scores.
Yep, I'm doing it right now.
Me too.
Thank you very much.
Right.
Okay, I'm so sorry I have a bad internet connection.
And Dr. JY and Dr. Jordan, remember to put the mark on the right group, yeah? This is group A.
Okay.
Okay, let me just invite the other group. Aditi, I invited you. Can you please accept? Okay, wait. Okay, Aditi is here.
So yes, I'm here.
Hi, Aditi. All the best.
Hi. Thank you.
How are you, Aditi? Are you ready for your presentation?
Yes, I'm definitely ready.
Smart doc.
Next is the fish. I'm so sorry. Okay, the fish. The fish. Okay, and the last person is Reshu. Okay, the teams are in. Are you guys ready? Oh, I only can see Aditi.
Yes, like Devesh and Reshu aren't here yet. Um,
Okay, there's Devish and Reshu is still waiting. Okay, Reshu. I'm so sorry, Dr. Debbie. Can you see Reshu in your list?
I can see the slide.
Oh yeah, but okay. I think Reshu is not here yet.
Reshu is not here yet.
Okay. Is there any other names, Aditi, that we can invite to the stage?
So you can invite Manita.
Monica. Um, what's the name again?
Anita.
Anita.
It's
Anita.
Manita. M-A. Acha, Reshu's here, sir.
Oh, okay. M.A. Manita.
Yeah.
Oh, okay.
Reshu
Reshu
came.
is here. Okay, great.
Yeah.
So, are you guys
Yes.
ready?
Yeah, I'm here.
Yes, sir.
Okay, great.
Yes.
Okay, 3 minutes. Okay, start. You can start your presentation. Good luck.
All the best.
Thank
Thank
you.
you so much.
Devesh, please go ahead.
Yeah. Hello, everyone, and can we move on to the problem slide? It's the third or the fourth slide. Yeah, basically, so the normal we will be experiencing post-pandemic will be the new normal and with new lifestyle and new norms. So also, basically, visiting a hospital will not be such a confident step among the population, and they will think twice before moving to mass gatherings, restaurants, or even shops. And they will be anxious, caution to move around, and there won't be a confident relationship between a patient and a doctor. We also need to point out that the mental issue that might seep in our daily life. So, uh, concising all of these, the gap that will be created, the adaptation to the new normal, and the anxious and the cautiousness among people to move around places are the basic problems that we will be experiencing in the new normal. And talking about the basic protocols, also the social distancing and the masks need to be compulsory to prevent such further pandemic in near future. So I will request Reshu to move forward with the solutions.
Am I audible?
Yes.
Am
Yes,
I
you are.
audible?
Please proceed.
Ah,
Yes, you are.
wonderful.
Yes.
Yes.
Yeah, so in today's world, we are all familiar with the technologies. So for the solutions to our problem, we have chosen AI as our companion. The main theme is to link the patient and the health practitioner through the virtual media. For that, we have designed an application where the patient can pitch in their problems and the AI will sort out and link them with what he needs to do is that will lead him to another page where he has to write down his symptoms, and on the basis of his symptoms, our AI would do a provisional diagnosis and link our patient with the respective specialist. For example, if a patient comes with a cough and a running nose, then he would write down his symptoms, and after that, our AI would do a provisional diagnosis of a common cold, and then it links him with a specialist of
Resh,
respiratory disease, and our
yeah.
and our
So
specialist will.
yeah. So we've basically designed an app which will be organized and which will be feasible and easily accessible for everyone to work upon. And we will actually collaborate with NGOs and non-governmental organizations to.
Okay, Aditi, the time is up. Okay, we're so sorry. Okay, judges, you may have questions. We're opening questions and answer session.
Can I ask you something?
Yes, Dr. Jordan, you may ask.
About the collaboration with the health organization, what kind of collaboration can you make it clear?
Yes, sir. So, sir, what the app that we are planning is it will be a connector between a specialist and a normal citizen. Like first, a particular work like. So what we will collaborate with we will collaborate with specialists and doctors and NGOs so that we can actually give free access and feasible access to the ones who can't afford.
Okay.
So that is the main purpose, because the reason why we want.
Is it kind of information or like health information or something like that? The AI, the
Okay, so
artificial.
sir, like yeah, so like a message would pop up first. You'll get a form, you will fill it, and according to that, the AI would direct you to the particular department that you need to visit. So maybe if I have a stomach ache, if I have a stomach ache, it will direct me to the GI department, and there I will be asked detailed information regarding what symptoms I'm facing. And according to that, the AI would then forward my call of my application directly to a specialist, which will further help me with my prescription and everything that needs to be done.
From home.
Yes, sir.
Yeah. Is it? So you no need to come to the facilities, something like that.
Yes, sir. You do not need to go there. You would only need to go there if it's really serious or it cannot be diagnosed on a virtual basis.
So is
Only
it
that
kind
would
of?
be the.
So is it kind of telemedicine, something like that?
So I didn't get the last word.
Uh,
Sorry.
Telemedicine. Can you got it?
Yes, sir. Yes, something like telemedicine. Because this application would not only have be a connector between a patient and a doctor, but it would also have a particular set
what?
of norms and regulations that we ourselves. So we need that the app would have a particular set of norms and regulations that we ourselves need to follow after the post-COVID era to prevent getting any further infection, and to have or take all the precautions that are needed, like the regulations that we ourselves can inculcate in our lives and be comfortable with, rather than having something that we aren't comfortable with and go on further. Yes, sir.
Thank you.
Okay. Any other questions from the floor?
Yeah, I have one question.
Okay, Dr. JY.
So basically, understanding is that you are trying to create an app that allows patients to consult a doctor from home itself, thus avoiding the need to go out and be in a crowded place. Am I correct?
Yes, sir. Yes,
Okay. All right. How would you ensure that the basically how would you ensure that your service basically covers all your population, because you need to realize that most of the patients are from lower income group. They may
yes,
not have a internet connection.
yes, sir. So, like, there's a chapter in AMSA India, like where I am from. So, there's this well-being initiative that's going on. So, related to that, I was thinking if anybody is not able to have an internet connection and go through the application, we can also have a telephonic communication with people. We can distribute a toll-free number, as many organizations have, and then there's the first person can come and ask a normal questions, and then that person can then further forward the call to the particular department and the specialist. So that's how
Okay.
yeah. Okay, sir.
Okay.
Any
Any more, Dr. JY?
No, that's all.
Okay, last question from the floor. How will you deal with anyone who dies because of an advice that the app gave?
So basically the app is not gonna give you advice. The app is directly just gonna take you to a doctor virtually. You do not, the only thing is it'll take you to the particular department that you need to go.
Okay. Thank you so
And
much.
yes, sir, the advice would be given by the doctor itself. Thank you.
Okay, thank you so much for your nice presentation, Group B.
Thank you so
Okay,
much.
good luck. So next we'll
Yeah,
be
thank
having
you so
Group
much.
C. Please be ready. Thank you. Okay, next is Group C. Let me check the name. Okay, first is Kevin. Okay, Kevin, you can accept the invitation.
Yeah.
Okay, next is Arpit. Okay, Arpit, you can accept the invitation. Okay, last is Rati. Rati, okay, great. So, are you guys okay? Great. So, Kevin and the team, are you guys ready to present?
Yes, we are ready.
Okay, great.
Yes.
So your 3 minutes start now.
All right. Good morning, everyone, fellow friends and doctors. My name is Kevin, and I will open up our team's presentation regarding today's hackathon. And we will be talking about tackling the infodemic. These are next slide, please. These are our members. Next slide. First of all, what is the infodemic? Next slide, please. All right. So the infodemic, an infodemic is an overabundance of information, some accurate and some not, occurring during an epidemic. Quoted from WHO. It makes it hard for people to find trustworthy sources and reliable guidance when they need it, especially in developing nations. Risk to individuals and community, distrust and confusion on science and the government's action and policies. It also increases anxiety in the public, especially during these times of new normal. Next slide, please.
For solution, we are doing podcasts in collaboration with Ministry of Health and Ministry of Information for making people aware of fake news and rumors. We'll telecast those podcasts from websites here on different social media platforms like YouTube, Facebook, and also on radio and television so that it can reach to every nook and corner, and also people with limited technology. Well, quite a few people are aware of fake news and rumors, but they are not being aware of differentiating and are in dilemma on which to believe and which not. We will be working with volunteers group of moderators and also with different social clubs for proactively reporting and calling out misinformation on different media. As podcasts are feasible financially as well, not that cost worthy, easily accessible and reachable, we thought it would be the best option for solving this problem. We can also use this platform in the future health crisis. Next, please.
So for the implementation part, next slide please. We have planned out a timeline according to which by the end of August, we'll be looking out for all the logistics like approvals, handles, collaboration, and volunteer calls. By mid-September, we'll be ready with our volunteers and topics to be covered. And by 1 month from now, by 22nd September, we will be ready for the launch. Next slide, please. Okay, for risk, language barrier can be one possible risk. For that, we'll look for translator volunteers who will translate the podcast to our local languages of our AMSA chapter. And then authentication from local authority is also very important. For financial planning, collaboration with GOs and NGOs will help us provide some funds, and we can also use ads to gain revenue. Most of the expenditure would be on groundwork and promotion. Podcast is something very easy and like low cost production, and since many of us are using social media and internet now, it can be a great deal for reaching out to a lot of people and having a larger reach. Next slide. These are resources. Okay, thank you so much.
Okay, great. So next we'll proceed to the question and answer session. Judges, if you have any questions, you may proceed.
Yes, I have one question actually. Why would you choose a podcast?
All right. So for podcast was one thing. Since we are basically trying to reach as many people as we can, so not a lot of people have a really good internet connection. So podcast is something that is on audio basis, and also the audio we will be recording for podcast. We will also be looking forward to uh, transmit them to the local people using radios and other audio like announcements and radios as well, so that it can reach to as many people as possible, even if they are illiterate or even if they are in the rural setting, since radios and audios are something that can be reached out to so many people around the world.
Okay, great. Any further questions, Dr. JY?
Oh, that's all.
Okay,
Uh,
Dr. Yes, Dr. Jordan.
can I? Uh,
Yes.
can you tell me what is your the unique of your idea? I mean, like, yeah, so many people have a podcast, and then so many people thinks about to eradicate the infodemics or giving the true or the right information. Are your purpose, right? But tell me, what is your special? I mean, like, what is special idea in this case?
Yes, sir. So first of all, since most the topic was infodemic, so people are being bombarded with a lot of information and also misinformation. So first of all, we also plan to conduct surveys and like taking polls, like what are the areas that people are most misinformed. So we will be keeping the topics concise, and also we will be looking forward to collaborating with various government ministries and also some celebrities, so that our information can look more authentic and it can like have a better impact, and then people can follow the real information that is supposed to reach to them.
And also, like, we are doing it in context of the countries like Nepal and India, which is a developing country with so much like not that well access of technology. People might not know or have difficulty in using applications and other apps. So from podcast, those people like who like believe everything, kind of everything, whatever comes in the Facebook scrolls, for those people it will give very much authentic informations. And like not only giving authentic information, it says like this kind of information is fake, and don't like, for it is like, don't believe that kind of.
And since also the internet has become the new normal, like it is reaching out to so many stratas in the society, like even the developing countries and the developed countries and the high class people to the middle class to lower middle class people, everyone is using internet. So podcast can be a way to reach them, and for the lower people, as I've already suggested, radios and other things like local announcements can be one thing that can be utilized.
Okay, great answer. So, how is it, Dr. Jordan? Any
Yeah,
further?
so you will do that in the like just one side information, or you have you will have the like question and answer in that podcast, or
Yes, sir.
just only give the information.
Sir, that's why we have recruited volunteers, and through them we will be reaching out to local people, because and handing out like on ground surveys as well, to see that everyone in the society is getting informed from this right information. And like we will then specially target the areas which people
Mhm.
are most like have the most myths and misinformation about.
Okay, so two-way what is like two-way information. I mean, like
Yes,
from
sir.
you, and then
Yes.
you got also the information infodemics from the community or from the social people. Okay, and thank you.
Yes.
Okay, thank you so much, Dr. Jordan. Any further questions from the judges, Dr. Debbie, or
I'm
comment?
I think all the questions already been asked. I thank you so much for your presentation, Afid.
Okay, thank you so much, Dr.
Thank you so
Debbie.
much, ma'am.
Okay, Dr. JY, any?
Yeah. I think you should consider including infographics as well, because if you are if you want to utilize social media, you should rely on things that are visually attractive to stop them in their track and read through your information. Posters and infographics will be a very good option. That's all.
Yes, sir. We'll definitely consider that in our promotion aspect of the podcast so that we can like make it more attractive to people, and so more and more people can join in.
All right.
Thank you, sir.
Thank you so much, everyone.
So back to you, Yudish.
Hello. Yes, I'm so sorry. I'm having a connection problem. I'm really sorry about that. Okay, I'm just going to invite the others to join. First is Akruti. Akruti, can you please join through my invitation? I'm still waiting for her response. Okay, still no response from her. Sanjina. Sanjina, can you please accept my invitation? Okay, Sanjina, join the stage. Leonard? Okay, great. Thank you, Leonard. And last
Hello?
is
Okay, there.
Akruti.
Perfect.
You please accept my invitation. Sorry, Leonard. Okay, Sanjina, join the stage. Yes, everyone has joined the stage. Samavi, can you show up the slide? Leonard?
Yes.
Okay, great. Thank you,
Yay,
Leonard.
finally.
And last
Hello?
is
Okay, there.
okay.
Perfect.
Samavi, the timer, please. Okay, great. You please accept my invitation. Oh, sorry, Leonard. Sorry, Leonard.
Yes, yes. Sorry.
Okay, Sanjina, join the stage. Oh, yes, everyone has joined the stage. Samavi, can you show up the slide? Leonard?
Yes.
Okay, great. Thank you,
Yay!
Leonard.
Finally.
And last is
Okay.
okay.
Let me go.
Oh, I'm really sorry. I think Leonard has a bit of delay there. Leonard, I'm so sorry. I kick you up from the stage and re-invite you again, okay?
Maybe Akruti can start.
Yes, Akriti, you may start if you want.
Hello, sir. I
There,
think I
there.
can.
Back. Hi, Leonard. Welcome back.
Okay,
Yeah,
okay, there.
I can try.
Okay, Group D, whenever you're ready. Are you guys ready? Leonard,
Yes,
I'm so sorry. I kick you up from the stage and
Hello, hello.
re-invite you again, okay?
Is it? Can you hear me?
Yes, we can hear you.
Can you hear me?
Maybe Akruti can start.
Yes, Akriti, you may start if you want.
Can you hear me?
hello, sir.
Hello.
I think I can.
Yes, Leonard. I think there's a bit of
I think,
delay there.
Leonard, I'm so sorry. Probably it's best for Akruti to do the presentation because
Yeah, is
your
that?
voice come to us only 30 seconds. Oh, Akruti left.
Oh, Akriti left now. Oh God. Uh,
Hello, sir. I can.
okay, Sanjina, you can please start. Okay, whenever you're ready. Okay.
Yes, sir. So the main concern of our title is the immunization in the new normal COVID-19 pandemics. Can you please next slide? Next slide, please. Yeah, so to define the problem, we have during the digital transformation brought about by the pandemics, and this poses a threat in the form of perpetuation of misinformation, such as in the anti-vaccine sentiments, traditional medicine as an alternative to vaccination, and there is a very misinformation from the social media and new channels which are very far away from the research and the true information, because people have such sentiments to directly trust the rumors. The most people directly trust the rumors, and the main, please next slide, please. Yeah, so here, next slide, please. Here, the main people affected might be the children in case of immunization, the children's, elderly, and the pregnant women, and the person with the uh, the person with chronic diseases, at least. Yeah, so there is a very huge gap in between the person and the healthcare professional, as the people would not be willing to go to their health professional in order to be prevented from getting infected with the virus, and so they will highly avoid to go there, and the people will be less immunized. So, next slide, please.
I think we can fast forward to the solutions because we're not going to finish on time. So for our solutions, we have a multi-pronged solution. Interventions for HCPs, which is a side stream approach. Interventions for the general public, which is a downstream approach. And on the legislative level, which is the upstream approach. So for the interventions for HCPs, it's important to educate them about the importance of vaccination and to organize immunization camps for them, identifying champions for the advocacy who will represent the cause. Um, we have to use nudges and regular reminders to vaccinate in healthcare facilities and conduct on-site vaccination to leverage conformity since their colleagues will be vaccinating. For interventions for the general public, we want to empower local government units to mobilize community task forces that will maintain a list of people with missing vaccines, effectively communicate to the general public that standard COVID-19 guidelines are strictly enforced at immunization centers, and we have to set up mobile immunization centers which can provide door-to-door immunization. Webinars, information campaigns that leverage the renewed interest in vaccination due to the COVID-19 pandemic, using the idea of building herd immunity for healthy adults, the idea of complications that vaccine-preventable diseases can pose for at-risk communications.
Okay. Thank
Yeah.
you so much, Leonard.
I would like to.
Yeah, the time is. We're so sorry, but the time is up for your presentation. Now we're going to proceed with question and answer session. So, judges, if you have any comments and questions, you may ask.
We
Hello.
can expound on our plans through your questions. Thank you.
Okay. Okay, Dr. Debbie, Dr. JY, Dr. Jordan, any questions?
No questions from my side. Thank you.
Okay, Dr. Jordan, do you have any questions?
No, I don't have any. But yeah, perhaps one question perhaps. So, what is your ultimate goal of this? What is for this idea? I mean, like to educate the people about the immunization, or
Okay.
you? Yeah.
So at the start, we were supposed to identify the different problems on different levels. So problems for health for different populations. With regards to healthcare professionals, with regards to the healthy adults, at-risk populations, children who usually get their vaccination from national immunization programs that are conducted in schools, but will no longer be able to um, subscribe to such programs because of the shift to online learning. So with this, we want to propose a multi-pronged solution that taps into different levels, starting with healthcare professionals who they themselves need to educate to be educated for them to be able to sell the service to the general public, and then interventions for the general public, which is focused on democratizing vaccination and making it more accessible. And then the priority for the fourth quarter of 2020 will be basically generating public demand, which will in turn pile up and help the cost gain traction, um, and forcing the legislators to come up with interventions that are more sustainable through policy due to the generated demand throughout time.
Hmm.
How is it, Dr. Jordan? Any further questions?
So, do you think the vaccination is I mean, like, very low? I mean, just only few people got the vaccination nowadays. Have you researched about that?
Yes, actually, COVID poses both opportunities and weaknesses when it comes to immunization uptake. Because we found studies on increasing health-seeking behavior due to the COVID-19 pandemic, correlating the renewed interest in pneumococcal and influenza vaccine with the pandemic. We've seen similar trends in previous pandemics, such as the H1N1, H1N1 pandemic, in which hospital visits increased after. But at the same time, yeah, so basically we plan to leverage this renewed interest in vaccination due to the pandemic, specifically from the respiratory qualities of influenza and pneumococcal and other similarities with COVID-19. But at the same time, we acknowledge that there like COVID-19 poses like barriers when it comes to due to the fear of at-risk populations from leaving their homes due to fear of acquiring the virus. And at the same time, children not being able to get vaccinated due to the lack of physical classes and the shift to online learning.
Okay, thank you.
Okay, amazing. Thank you, Leonard, for the answer. So, any more further questions from the judges or from the floor?
No, it's very good. Thank you so much, Ken.
Great. Yes, I think that's all. No further questions.
We apologize
Okay, great.
for not
Thank you.
finishing. Yeah.
Yeah. Okay. So I think we just end the session here for the questions and answer for Group D. Thank you so much, Leonard, Akruti, and Sanjina for your nice presentation. Wish you all the best. Next up will be Group E. Please stand by. Okay, Sabine, I've invited you to the stage. Please accept it. Okay, Sabine is not. Okay, next is Samyak from India. Okay. And Bhavik. Bhavik, you can accept the invitation. Great. Now it's left with Sabine. Sabine, are you there? Please accept the invitation.
Sabine, here yet?
Yeah, Sabine is one of our winner for the Wi-Fi competition. Okay, great. Sabine accepted.
Actually, we would like to invite Sanjana.
Okay, Sanjana.
Yeah,
Okay, so can you please spell the name S-A? Okay, Sanjana. Okay.
yeah, Sanjana.
Okay, Sanjana, I've invited. Okay, great. So three of you already in the stage. Okay, Bhavik, Sanjana, and Samyak, if you are ready, just let me know.
Yes, we are ready.
Okay, great. Please be ready. So the 3 minutes starts now.
All right. So, hello everybody. So we are Group 2E, and the theme obviously is lay new norm. So I'm going to start this with what Dr. Kenneth said in the morning. So we know that what is risk? It's hazard into exposure into vulnerability, right? And so hazard and exposure, God knows that it's going on in the whole world right now. So let's focus on the vulnerability aspect, right? The next slide, please. The next slide. So, all right. So for the problem, we have identified the vulnerable groups, okay, and we have divided them into two categories. One is like the medically vulnerable group. That is people with comorbidities and previous COVID patients are prone to develop complications. We all know this in the recent articles, it was mentioned as well. So the question is, how do we intervene this and provide them treatment in the current scenario, right? And the second is economically weaker sections. They are more vulnerable because they have a poor nutritional status. And we all know that how immunity is affecting COVID health status of every individual, right? Now let's look at the solutions. Next slide, please. The next slide. Okay, so this is what we have suggested to tackle these issues for this first economically vulnerable group. We are thinking of building an app to deliver homemade food to the needy, and also now the thing is, so we all know that applications like Zoom and Swiggy, they are like delivering hotel-made foods to people, right? But they are economically like strong. For these people, we are planning to include a general population, so homemade food, and will deliver them. And next thing is medical students will be in a subpopulation of this app. And through this app, we are planning to also organize medical camps for those people. For the medically vulnerable group now, the second part. Okay, so also other group mentioned about how social media is useful, right? It's also useful in scientific field. Like Telegram is a messaging app, but there's this thing Telegram bot, which helps in basically keeping track of what is going on in an organization. Like suppose you have an equipment, right, and in that you are culturing some bacteria. So how to manage the doses and everything. Telegram bot is doing that nowadays. Okay, so we are planning to use that in a medical scenario. We'll see later how. The next slide about the implementation. The next. All right, so this is the pathway towards resilience, right? So data is collected, how it's written, and the mechanism. Yeah. So basically, in the Telegram bot, every step of the medical, of providing treatment to the patients is not compulsorily needed to be done virtually, but some steps of it, like serological investigations or radiological, can be included in the virtual aspect, and there can be a whole systematic organization in an app like Telegram. Yeah, and also for EV group, this is the subpopulation, and for feasibility, we are planning of teaming up with the delivery apps initially and then becoming independent. And this is networking and feedback. The references slide, please, just if anybody wants to look at it.
Okay, time is up. Thank you so much, Samyak, for your presentation. Okay, now we proceed to the question and answer session. Judges, if you have any questions, you may unmute yourself.
How would you? Hi, I have a question. How would you make sure? How would you recognize which are the areas of the people that need this nutritional supplementation? How would you decide
Yeah,
who
so
you can help?
Okay, so basically it's about identification of the vulnerable group and what kind of nutrition they need, right? So what happens in these apps is that people focus more on the large term organizations. They somehow forget about the local organizations, right? And colleges like PSM department, they go out for surveys. So they do that. And that is how we are planning to identify the vulnerable groups, first of all. And as for the nutritional status, so as I mentioned, like medical camps. So we had divided into steps. So the first step would be like a general medical camp, where we can just get to know the population and then correlate it with the surveys that I talked about before. And after that, so that is how we'll create the data. And the next medical camps will be for the solutions, like treatment and stuff, right?
Also, I would like to add, I'm sorry, I would like to add that AMSA is now starting another thing called MRSA, and MRSA will be connecting to different colleges. And in colleges, they have a department called community medicine, and they focus on the vulnerable or the underdeveloped areas. So even through that, we can connect to the people who need medical facilities and much more.
Okay, so AMSA will. How do you propose AMSA to be the is it the coordinator, or what AMSA would do in this all scheme of things that you have in your mind?
So AMSA is a well-established organization, right, who wants to contribute to the upliftment of society. So the thing here is that AMSA will provide the manpower, first of all, right, and networking, which are the two essential components to do almost any activity. You need people, human resources, and also networking so that we can reach the community. And as a group, in Aditi mentioned in group 2B, for the networking issue, we'll also have the toll-free telephonic number for anybody to reach us if they don't have enough internet connection.
Okay, thank you.
Okay, thank you so much for your answer. Any further questions? Yes, Dr. JY.
No, I don't have any further questions.
Okay, Dr. Jordan?
No. Pass.
Okay, from the floor, is there any other question, attendees, you may ask? Okay, one question in. Okay, let me see. Okay, this from Ananya. How will the economically vulnerable groups accept your apps, given that economically vulnerable group will not have enough internet access?
I think I mentioned that while answering Debbie's question, like to some aspect, right?
Yes,
Sanjana?
Okay, it will be the same
Yeah,
answer.
we've spoken about the economic vulnerability because those people will not have apps, neither they might even not have phones. So at that time, that is what we'll use the local healthcare workers, like in India we call them Asha or Dai. So they will have access to the people, and they will bring the concentration of this into the local healthcare facilities, and eventually it will also go into the primary healthcare and further into the community healthcare. So basically over here, it's mostly oriented toward the social care workers and how we connect.
Okay, amazing. Okay, is there any further questions from the floor?
I saw a question like one of the participants asked, how will we manage the app, right? So I would like to answer that. Yeah, okay. And I think I can speak slowly now. Okay. So the thing is that in many of the universities, a new, I don't know, how do you call this? Organization part is coming up, especially like outside India. The thing is, like students, they work for 4 months in very small local setups of IT companies, right? And what happens is that later, like more well-established organizations, they have a team up with those small IT sector companies. So basically, and we'll be contacting the universities. So that is how we are planning to make it more feasible, so that we can actually implement it. It's not like we need to create an IT company being medical students, but we can obviously connect with various IT sectors, small local companies, right? And then AMSA or major medical organizations can team up with, and it would be, I think, a perfect combination, so to say.
Okay, great. Perfect timing. So thank you so much, Group E, for your great presentation. I hope all the best for you.
Thank you, sir.
Thank you so much.
Thank you. So we're going to proceed with Group F. Let me just, sorry. Okay, for Group F, we have Nanya. Okay, Ananya. Ananya, please accept the invitation. Great. Then we have Stray. Stray or Stray? Can you please? Okay, great. And lastly, we have Ayasham. Ayashama. Okay, great. Everyone has joined the stage, I guess. Okay, hello, Ananya.
Hello.
Ayashama. Hi. So, yes, you are. So, are you guys ready?
Okay, I Shama will start. Yes.
Okay. Okay, the 3 minutes for you guys starts now.
Okay, warm welcome and greetings to respected jury members and all the AMSA family present here today. We are Team Group F here to present you on our mental health support app. Next. Mental health, it can be complex and can take many forms. As we can see from the data that 20% of the population have mental health condition, with 1 in 10 young people having experienced a period of major depression. Next. As we all are living in this situation, we can relate that COVID-19 had significantly impacted our daily life by bringing us to pause. And it's completely understandable that people are experiencing fear in context of the COVID-19 pandemic. And we can see here in the data that mental illness among the adults due to COVID-19 has increased by 17% during this quarantine, in addition to the 20% earlier. One of the reasons we all suffer from this is either we don't know what we are experiencing or do not have access to the resources. Considering this, we have come up with a solution. Next. And that is a Real Talk app, which is free, quick, and easy platform that uses data-driven method to recommend support group to users, which not only will help in the current condition, but also in the future to share support and stay connected.
Okay, Aisha, I'll take it from here. So next slide, please. Okay, I'll be explaining how this app works. So we've shared the prototype on the chat. A person signs up using an anonymous name, and then they're prompted with a questionnaire which has mood evaluation, day-to-day activities, etc. It is in the MCQ form and it is graded. For example, 1 to 10, 10 being that I feel awesome, and 1 being that I don't feel that good. And then we will suggest them groups to join, which are self-help groups and the game groups. Now, the main feature of this is that there is a habit developing center and a to-do completing game app. So, in this, we will suggest them daily activities that they have to do, and we will discuss, and they can discuss their dailies in the groups, and we will give them habits. For example, if someone is depressed and they can't get up every day, so we'll give them a daily to get up and take a shower, or we'll give them, or if someone has a nail biting habit, we'll tell them not to develop that habit. So every time they don't do it, they'll get points. And now these points can be used in a game where they will defeat a boss. And there's also a feature of maintaining your diary. So that can be a daily activity in which they have to fill up their diary about their feelings. Now in the future, we hope to include a psychological consult in this. Can I have the next slide, please? This will be through NGO or paid or coupon codes for frequent users, fitness activities affiliations, which will be our sponsors, yoga or art of living workshops, which we can collaborate with. And why this app stands out is because of its anonymity and game features. So we hope to develop habits in people who have mental illnesses. Thank you.
Okay, thank you so much. The time is up. Now we proceed to the question and answer session. Judges, if you have any questions or comments, you may ask. Yes, Dr. Jordan, Dr. JY, Dr. B. Any questions? Yes, Dr. Jordan.
So is it cost free of charge or no?
Yes, this app will be free of charge because we have to develop the app, and that's it.
And you will also give the like prescription of the. I mean, like if there is a there are many of people have the like depression or something like that, truly depression. So so in this case, how far did the application help them? I mean, like do the application, we'll arrange them to go to the psychiatrist or something like that.
Thank you for your question. So, through this application, before they join a group, they will get a description of what the group focuses on. For example, if many people in that group have anxiety, so the description will be that people of this group face from anxiety, and there will be trigger warnings, which will help so that they don't have any panic attacks or anything on words that they don't want to discuss. So, and apart from that, if they need a psychological consult, that will be paid, or we could look into an NGO for people or psychologists who would want to work free of charge for a social cause. And we can also give coupon codes for frequent users, but there will be a psychological consult option in this app.
I see. I think this kind of application, I think, is a good idea also, because many people right now is getting depression or get a panic attack, something like that. Yeah. So yeah, I have so many friends or patients feel like that also. So they need someone or something that can give the solution of their depression or the panic habit. Okay, thank you.
Thank you. Thank you.
Hey, thank you, Dr. Jordan. Any question from Dr. JY, Dr. Devi?
No, I'm happy.
No,
Thank you.
I'm quite happy with your presentation.
So much.
Thank you.
Okay, thank you.
presentation,
Great. Okay, there's this one question from the attendees from Mehul. How will you make sure that rural population who do not use smart? Oh, I think this for the previous. Oh, yeah, right. How will you make sure that rural population who do not use smartphone take benefits of your app?
So for now, we have.
Thank you.
Oh yes, please. Yep. Anyone
I would say that our app is quite adaptable.
Yes, Trey, you are audible. Nanya,
Our
I
app
think you
has a
can
very
also.
adaptable design.
Oh, yes. You may continue, Trey.
Uh, our app has a very adaptable design, and it's inexpensive. And moreover, there are many games and etc., which makes it especially important in isolated communities to have an access.
For people who do not have smartphones, to answer the question, people who do not have smartphones, we want a website to work this. And if we do not have internet access or any other such device, then it will be difficult for them to use. But hopefully in the future, we can find a way around this as well.
Okay, great. Thank you for your answers, Trey and Ananya. Any further questions from the floor or judges? Okay, I see none from you. Okay, thank you so much, Group F, for your nice presentation. Hope you guys can win this. All the best.
Thank you very much.
Thank you. Great presentation.
Thank you.
Okay, now we proceed to the last group, Group G. So Group G, are you guys ready? Let me just invite you one by one to the stage. Please wait for a while. Okay, Ajita. Nisha. Okay, and lastly is Kushman. Okay, everyone is in. Wait. Okay, great. Hi, Ajita, Nisha, and Kushman from Group G. Are you guys ready for your presentation?
Yes.
Okay, great. Okay, the time starts now.
Hi everyone, I'm Ajita and I'll be talking about reimagining medical education. Because of COVID, we know, next slide please. Because of COVID, we know our education has moved online, and one of the main challenges is this one-dimensional flow of information, leaving students demotivated and alienated. and there's definitely a lack of interaction among students and also with the teachers. The other problem is because we're not being able to practice to maintain a rapport with the patient. This acts as a major disadvantage later on in our career. Also, not being able to witness the signs and symptoms that the patient presents with clinically is also a disadvantage. Not being able to go to the operation theater, which I would say is a highlight of medical school, is definitely brings the fun out of medical school. And also because we're not being able to conduct the exams in this situation, the academic calendar is delayed and the students are actually losing time. Next slide, please, Nisha.
All right, so for our group solution, for the theory part, for the medical school, we are suggesting that conducting medical examination interventional strategy can be implemented, then be doing a regular virtual mode of classes to be more interactive, and PBL, problem-based learning, and case-based discussion among the medical student. And then also, we improvising the available online content by partnering with companies and virtual education platform, such as AMIT and so on. And then for the clinical student, we suggest that small group for the clinical rotation with a proper precautionary measure to be followed so that they're able to attend their clinical posting. Okay, next.
Yeah. So the last part, implementation of idea. Our hack is simple. We are not proposing something new. It's existing. AirMeet is already there. So what we propose is shifting weekly classes from other platforms to a more interactive platform, that is AirMeet. Of course, there are limitations, but proposes that, a teacher or a professor discusses the followed by division of students for problem-based learning, case-based discussions, and various other assignments wherein they can interact more, discuss on the cases more, and work together. So that's a very simple sum up of our idea of not proposing something new, whereas reimagining or reinventing the current methods that are already being implemented into the medical education and improvising them to improve on a better method of learning and a more interactive method of learning. So having said that, thank you.
Okay, nice presentation from the last group. Now let's proceed to the question and answer session. Judges, if you have any questions or comments, you may unmute yourself.
Yeah, I have a question. How
Okay,
do you
Doctor.
propose to, because you have mentioned one issue earlier on in your problem identification, you were talking about there's lack of access to operating theater, and then especially how would you don't get to touch patient and all, so how do you propose to solve this problem through virtual learning?
Right, sir. Thank you for the question. So as we mentioned, improvising the online learning by partnering with various educational platforms and companies. Like, for instance, there are a lot of platforms providing simulation. One is that option. The second option that we proposed is a more interactive kind of learning, wherein if the students are not able to go to the clinics get is brought up to the door. So what this means is the professor or I would say the facilitator helps facilitate the discussion by either by a simulation session if a real life patient or a real life interaction with the patient is not possible.
Okay.
Okay.
So actually what you are trying to say is that instead of
Yes, Dr.
the
Debbie.
didactic approach, the students need to be more proactive in order to receive more education during this period.
Yes, Dr. Debbie, that's a self-directed, I would say self-directed learning is a kind of an approach that we are promoting and
I
improvising
think it's
on.
very in line to the future. Thank you so much.
Thank you, Dr. Debbie.
Great. Thank you, Dr. Debbie, and for the answer, Kushman. Any further questions from the floor or from the judges? Dr. Jordan?
No, thank you.
Okay,
Enough.
great. Enough from Dr. Jordan. How about the floor? Is there any question before we close this session? Okay, we have no more questions from the floor. Okay, I think it's enough, Dr. Debbie, Dr. Jewa, and Dr. Jordan. Okay,
Yes.
thank you so much, Group G, for your presentation. All the best
Thank
for you.
you. Thank
So,
you.
next, we have judges session and announcement of the finalists. So, judges, if you have any comment for the 7 group, any comment for the groups? Dr. Debbie first, I think.
I think you are doing wonderfully. Thank you so much for this for the presentations that you're giving, and from 3D printing to school curriculum to apps for mental health. I think every of these are important for the future and for the implementation of nutrition, of vaccination. I think that a lot of I am very amazed that you all come up with something different. So it's awesome. Wonderful. Thank you so much for your effort. And I want you to remember that there is no such thing as quote unquote winner. Of course, they're going to have the top three will go forward. But I think all of you are winners because you come here to this day and then you participate in hackathon and bring forth your ideas for the future. I think you are amazing. Thank you so much. You're all the star.
Great. Thank you so much, Dr. Devi, for your nice comment. Okay, next up, Dr. JY. Any comments for the participants?
First of all, great presentation from all 7 teams. You have done well given such a short time of preparation, and I share the same sentiments as Dr. Devi in the sense that I think most of them have. All the teams have done well. You have identified a good problem. You have provided a sound solution. Okay, so best of luck to all of you. And just one additional commentary: when you come to solutions, how you present your solution will actually affect the, how do you call it, the impression from the judges. For example, it will be better if you can go in depth about your solution. For example, instead of giving a very generic statement, you can go in depth. For example, you know which what kind of okay, for example, let's say you're giving an app-based solution, so you know what kind of app you are envisioning, you know what kind of companies are there to exist to help you with your solution, and what kind of potential problems that you might come across. If you are able to identify that, it shows that you have a good insight on what you're dealing with, and you have come prepared to face some of the potential downfalls when you're trying to solve your problem. So that will give you some extra marks when it comes to your presentation. Okay, so best of luck to all the groups.
Okay, thank you so much, Dr. JY.
You're
Lastly,
welcome.
from Dr. Jordan.
Okay. Yeah, I don't have anything to say because yeah, all of you doing good, and then also I think the important thing is all of you must be detailed. Yeah, have to give the information detail. But oh yeah, I know the presentation time is very short, but for the idea, I think it's quite genuine. Yeah, and then apa, and then I really appreciate of your idea actually. Yeah, good luck for all of you. Thank you.
Okay, thank you so much, Dr. Jordan. So, the scores is in, and we're still calculating. So, finger crossed for the competitors. Yeah, we're going to announce that soon. Probably for now, we can have a bit of chit chat. Probably, Dr. Devi, or you want to have a break? and then we're going to back
Let's
live.
do a poll on break or chit chat. Okay.
Okay,
Do you want a break? Yes or no?
break for probably like 3 minutes.
Yes.
Or you want us to have a chit chat?
I will strongly advocate for a break.
Okay, yes. Anyway, we
Me
have
too. Break.
73% of people says yes, break. Break,
Okay,
please.
we're going to have a break for 3 minutes, and we're going to be live again for the announcement.
All right, sure.
Okay. Thank you
Okay,
so much.
thank you so much, everyone. See you soon, like in 3 minutes.
Yes.
Yep.
I want to know.
Great job, everyone.
Amazing job, everyone. Very proud of you.
Amazing, awesome. Okay.